And to have this discussion here today is so critical. Your perspective is incredibly valuable, and it does inform the work that we do in Congress. And I know from years of experience, but I think back to my days in the state legislature serving on the healthcare committee, where the late great Representative Mitch Green that constantly reminded us that the brain is part of the body and that mental health is just as important as physical health to our overall well-being. And even though Oregon and other states have been grappling with a lot of challenges accessing behavioral health care, we have been making some progress. So I want to start out by saying that. I'll shout out to the Balmer Institute, doing some great work to prepare people to work in the field, and the Center for Excellence for Behavioral Health and Aging, the partnership between PSU and OHSU to address the workforce needs, which is really important part of providing services. But we know there's a lot of work to be done. Oregonians, like the experts we're hearing from today, are an important part of that. I just want to agree with what Representative Salinas said about the challenges ahead with this current administration and the GOP leadership really threatening to undercut the work to expand access to mental health care and put a lot of Oregonians and Americans at risk. I serve on the education committee, and so I want to really spend a little bit of time recognizing the needs of our youth. And I constantly hear about the need for more student mental health resources, particularly after the isolation of the pandemic. Gun violence, social media, there's so many issues, the planet warming, there's just a lot of issues affecting youth today. Our former Surgeon General, Vivek Murthy, said that the increase in youth mental health needs is the defining public health crisis of our time. And the most recent CDC Youth Risk Behavior Survey reported that in 2021, and this was a few years ago, obviously, 42% of high school students said they experienced persistent feelings of sadness and hopelessness. That's a 13.5 increase from 2019 and a 50% increase since 2011. And I have to say, my prediction is that it's not getting better at this point in time. Oregon has one of the highest rates in the nation of youth reporting serious thoughts of suicide. So under the Biden administration, we passed the Bipartisan Safer Communities Act, and we celebrated that. Many of us successfully advocated for this to include critical funding for mental health services at schools, and that investment was making a difference in Oregon schools. It helped pay for more counselors, psychologists, social workers, and it's especially important for schools that serve low-income and rural communities. One of the rural school districts in Oregon went from 2 school mental health professionals to 7 because of this funding, and it was really critical. These grants increased access to life-saving services. Well, this administration just canceled $1 billion in grants without warning under this program, meaning that schools will either be forced to find tens of thousands of dollars they don't have. And we're both served in the state legislature. We know there's not a lot of extra funding sitting around for that, even though it's important and it's recognized it's important. Or they're going to have to let go the people who are helping students struggle with mental health challenges. And one rural Oregon superintendent said to be able to provide these mental health services and then have it ripped away for something that is completely out of our control, it's horrible. Another quote, "I feel for our students more than anything because they're not going to get the services they need." That's unacceptable. And we've seen this sort of streak of what feels like cruelty throughout this. It's hard to believe it was a week ago, but the bill that passed, this was called a big, beautiful bill, but I call it a big, bad bill in the dead of night. And particularly with the Medicaid funding, the gutting of Medicaid, and also we know affects Medicare and food assistance, SNAP benefits, serious cuts. And we know that in Oregon, 1 out of 3 people are covered by Medicaid. A lot of those are children. So without that coverage, people are going to lose access. Local provider explained that people who lose coverage don't disappear. They just show up with worse health conditions that could have been managed by better preventive care. And so Medicaid cuts don't just affect the patients, they affect the entire healthcare system. I was recently at a community health clinic in Hillsborough, and they said they were able to expand their behavioral and mental health services because of Medicaid expansion. That was part of the Affordable Care Act. And Oregon really has been a leader in that. And importantly, they were able to hire providers who are bilingual so they could better meet the needs of the patients they see. But they're extremely worried, as are many, about these Medicaid cuts and whether they're going to have to lay off providers. And again, that doesn't just affect the patients, it affects the entire healthcare system. Some community health centers might have to close their doors if this bill passes in the Senate the way it passed in the House, which we're hopeful does not happen, really hitting rural and low-income communities the hardest. It's also not fiscally responsible because it doesn't make America healthy again, and it doesn't save money because, as we know, people just don't get preventive care and then go to the emergency rooms, and that is expensive and obviously not best for anyone. So also I wanted to mention a few other policies, particularly when I focus on youth, some of the things that I hear from students that they're going through on people of color, people in the LGBTQI plus community, people with disabilities and immigrants. All of those populations now are feeling targeted. And I have to say, at a town hall meeting I had in Hillsborough a few months ago, a little girl, fourth grader, little fourth grader, handed me a letter in a sealed envelope, and it didn't have a name on it, but when I got home, I opened it up and read it. And she wrote about how she's scared at school that ICE is going to come in and take her friends, and that she's going to get on the bus, and that ICE will take her friends from the bus, and that her friends will get home and their parents won't be there. This is a fourth grader. This is what kids are going through in school right now, and that's some of the fear that they're facing. A fourth grader. Students should never have to face that kind of stress and anxiety, especially inflicted by their own government. At another town hall, I heard from a Portlander who works with trans kids. Their clients are terrified and expressing suicidal ideation, and they see politicians pushing discriminatory policies that affect their rights. And that's something that we have to grapple with students who are in our schools, with young people, with anyone who is going through this kind of stress. We have an incredible responsibility as elected officials. And I have to say that even though this is a bipartisan caucus and the bills Representative Salinas mentioned and some that I'm working on are bipartisan, I think overall we see a disconnection between the people who are making the policies and the real challenges facing our constituents here in Oregon. If there was a serious commitment to addressing mental health, we would work on ending hunger and address the affordable housing crisis and expand access to healthcare and childcare and increase opportunities for arts education, something I'm a big supporter of. For students in schools, because we use art therapy for veterans with PTSD. We need to have a creative outlet for kids in schools. There's just lower the cost of higher education so more people can enter the field. So those are challenges we should be working on, but instead this is this policy that passed last week is primarily done to continue big tax breaks. And it's heartbreaking, but I'm really grateful that we're having this conversation because we're going back next week and we'll continue to do what we can to turn things around. A lot's up to the Senate, but we're going to continue our work because we understand the importance of meeting the needs of people in our communities.